Hi, welcome to Austin Smiles. We're so excited to have you join us on our upcoming mission. Austin Smiles, the Austin Plastic Surgery Foundation, is a nonprofit organization whose mission is to provide sustainable surgical and post-surgical care to children born with cleft lip and cleft palate in both Central Texas and Latin America. Let's discuss some basic information regarding cleft lip and palate. What is a cleft? 1 in 700 babies are born with cleft lip and/or cleft palate. Cleft conditions are some of the most common congenital facial differences in children. These conditions occur when the tissues and bone of the mouth do not fuse properly in utero, resulting in an open space in the upper lip and/or palate. A cleft lip is an incomplete closure of the upper lip, which can range from a small notch or incomplete cleft to clefts that extend up into the nostrils, a complete cleft. A baby can be born with a bilateral cleft lip, which involves both sides of the lip, or a unilateral cleft lip, which occurs only on one side. A cleft lip can be diagnosed in utero as early as the 13th week. Isolated cleft palates are harder to see in ultrasounds and are sometimes not diagnosed until birth. Early diagnosis of cleft conditions allows for families to receive early intervention from a craniofacial team. While the exact cause of cleft lip and palate is uncertain, a child's genes and some maternal health concerns such as diabetes, use of certain medications, smoking, alcohol consumption, and lack of vitamin B can increase the risk. In addition, poverty, nutrition, and environmental factors play a large role in cleft conditions. Health and developmental impacts of cleft conditions. Children with cleft conditions often face one or more of these health problems: difficulties with feeding or eating, delayed speech and language development, as well as speech errors, respiratory conditions, recurring ear infections or hearing loss, compromised dental and oral health. Moreover, they often experience social and emotional issues related to stigma, ridicule, and feelings of isolation. Let's look into some timelines for cleft procedures. For cleft lip surgery, a typical initial revision occurs at 3 months of age or when the baby has reached 10 pounds. Patients are given general anesthetic, and the cleft lip will be repaired and closed with dissolvable stitches. This operation usually takes 1 to 2 hours depending on the severity of the lip, and in our missions, most patients are in the hospital for 1 night following surgery. The stitches will dissolve on their own, and therefore no post-operative visit is necessary to remove them. Initially, the patient will have a scar, but the surgeon will try and line up this scar with the natural lines of the lip to make it less noticeable. This scar should also fade and become less noticeable over time. Although surgery is recommended between the ages of 3 and 6 months, due to the lack of access, our patients are typically older. Age ranges for a primary lip repair can vary from 3 months to 15 years old, or even older if a patient has never been able to obtain surgery due to an array of reasons. Surgeries for cleft palate repair can begin at 14 months of age. The gap in the roof of the mouth is closed, and the muscles and lining of the palate are rearranged. The wound is then closed with dissolvable stitches. This operation usually takes 2 to 3 hours under general anesthetic, and most children, like the lip surgery, are in the hospital for 1 night afterwards. The scar from palate repair will be inside the mouth, and stitches will be completely dissolvable. As mentioned earlier, even though the recommended time frame for palate repairs is 14 months, our patients are typically older because of lack of access. In some cases, additional surgery may be needed at later stages to improve results as the facial structure of a patient changes. A child born with cleft lip and palate in the United States could easily undergo close to 20 surgeries as they age into adulthood, including, but not limited to, lip and palate revisions, jaw surgery, rhinoplasty, ear tubes, bone grafting, and other surgeries. One such revision performed on our medical missions are cleft rhinoplasties. Cleft Cleft rhinoplasty is a surgery performed to either correct the stigmatizing appearance of the nose caused by a cleft lip, assist in the improvement of breathing for the patient, or both. Cleft rhinoplasty commonly involves making the nostrils symmetric, straightening a nose, and improving the definition, symmetry, and projection of a nasal tip. One other common revision surgery is a bone graft, used to repair a cleft in the gum using a piece of bone, usually done at around 8 to 12 years of age. Unfortunately, we're unable to do bone grafts due to the longer recovery time and extensive post-operative care. Finally, please keep the following in mind. Although the repair of a primary cleft lip does have an aesthetic component, having a cleft lip repair is not just cosmetic. The focus is to restore function to the lip and mouth. Do not assume anything about how a patient or parent feels about their condition. Avoid making assumptions or generalizations, such that a parent must be happier now that their lip is repaired. Keep in mind, many parents report missing their baby's old smile before surgery, and can even be shocked when first seeing their child. Please be mindful of their emotions. Photos and stories help others learn the importance of what we do. It's important to ensure these messages, images, and wording match the mission of Austin Smiles. Try to avoid evoking pity for patients, and take into consideration their feelings. Your wording should not contain any negative connotation to the baby's appearance prior to surgery. Instead, focus on the functional improvement that surgery provides. And always avoid sensationalizing cleft or the ways in which it may affect someone's life. It's important to highlight the needs of this community without patronizing or infantilizing people affected by cleft. Please, please, please do not post pictures of sad, crying, or vulnerable children and families. Austin Smiles' mission is a happy one, and we should focus on smiles. Again, thank you so much for your contribution. We are so excited to have you on this trip.